Hello, thank you for watching Alameda County Employees Retirement Association, the Medicare Transition Seminar. Through this seminar, we're going to go ahead and go through some introductions to items that you need to be aware of. We're going to have a Medicare overview, Acera and Medicare mandate, Medicare, how it works, Medicare plan options, Acera, the Wellness and Disease Management Initiative, and we can talk about the document return of your enrollment items. Who is eligible for Medicare and who's involved? Well, people 65 and older, under 65, disabled, people any age with end-stage renal disease or ALS. Who's involved? Social Security Administration and the Center for Medicare Services, CMS. If you're currently receiving a Social Security check, you will automatically be enrolled in Medicare Parts A and B. If you are not, then you would need to we recommend that you contact Medicare ahead of time so that you can begin the process for receiving your Medicare A and B. Medicare Part B premium will be deducted from either your Social Security check or you will be billed directly. They bill quarterly if you're paying directly, which means you'll receive a bill for 3 months worth of that premium. Your Medicare card will automatically be mailed to you. Note, some retirees or dependents who are disabled may be eligible for Medicare earlier than age 65. If you have a dependent or if you are disabled, you may contact Social Security and inquire with them to see if you meet their criteria of disability so that you may be granted your Medicare earlier. This will save you some money on your medical plan. Not receiving Social Security? If not receiving Social Security benefits, although most retirees are eligible to enroll at age 65, everybody can actually apply for Medicare at 65. For those eligible at age 65, we encourage you to begin the following process for enrolling in Medicare at least 90 days prior to your 65th birthday. You want to contact Social Security Administration at 1-800-772-1213. You can also walk into their office. However, you may have a long wait. Sometimes it's easier just to go ahead and contact them, make an appointment, so that when you do arrive, you can be seen appropriately and timely. You may also visit Medicare at www.medicare.gov to enroll in Medicare Parts A and B. Acera's Medicare mandate. When you or your dependent become Medicare eligible, in order to continue enrollment and receive the medical plan benefits that you're entitled to, you must complete the enrollment process in an Acera-sponsored Medicare medical plan. This mandate also applies to retirees who are receiving the monthly medical allowance. Currently, the carrier Acera offers with Medicare group plan is Kaiser Permanente. Those who do not wish to enroll in Kaiser Permanente Senior Advantage Plan may contact via benefits to get enrolled into an individual Medicare plan that may be nationwide. Acera's Medicare mandate. Why is the mandate of value to you in Acera? For this, we'll use an example of a member who only has 17 years of service, turning age 65 and Medicare eligible. This member enrolled in Kaiser HMO. The monthly premium for that during 2020 is $785.44. The MMA they are eligible for, and Acera will subsidize, is $433.99. This leaves an out-of-pocket cost of $351.45 to be deducted out of their monthly retirement benefit check. This same member becomes Medicare eligible, enrolls in our Senior Advantage plan. The premium for that during 2020, $411.54. The MMA they're eligible for, $411.54. This leaves an out-of-pocket cost to them every month of $0 to have the Senior Advantage plan. What is Medicare Part A? When you become eligible and enroll for Medicare, Medicare Part A provides the hospital insurance. It helps to pay Medicare-approved hospital stays in long-term care facilities, rehabilitation, some not long-term care. They do have a limit on that. It takes care of hospice, home health care, although there are limitations. Hospital care from qualified Medicare providers is what will be taken care of. You typically do not pay for Medicare Part A coverage. However, if you did not pay Medicare taxes while you were working, then when you do apply, Medicare may try to bill you for Medicare Part A and charge you a premium. We'll discuss that in just a moment. Enrolling in Medicare Part A. For the majority, Medicare Part A costs nothing because you or your spouse or your ex-spouse, if you've been married for at least 10 years, paid Medicare taxes while you're working and earned the necessary quarters towards the Medicare Part A. For 40 plus quarters, it's free. No premium for Part A. Anything less, and there's a slight premium for the Part A. For 2020, you may pay up to $458 monthly to buy Part A if you don't get premium-free Part A. In most cases, if you choose to buy Part A, you must also have Part B and pay the monthly premiums for both. Part A does have a late enrollment penalty, and you may have to pay a higher premium for twice the number of years you could have had paid for Part A for when you didn't sign up. Okay? Now, for those who are required or asked to pay a premium for the Part A, Acera, we do have a Part B only Medicare plan, Senior Advantage, which means you can waive your Part A, not have to pay that premium, and just enroll in Medicare Part B, and therefore enroll in our Senior Advantage plan with Kaiser, Part B only plan. However, you must remember, if you ever decide to relocate outside of the service area of this Senior Advantage plan with us, you will need to get your Part A. Individual plans require both Medicare Parts A and B to be enrolled, and you may be susceptible to a penalty for not enrolling in the Part A back when you could have. For more information on that, you may want to speak with Medicare in regards to the possibilities of that. What is Medicare Part B? Medicare Part B provides the medical insurance. It helps to pay Medicare-approved doctor services, outpatient, preventive care services, diagnostic tests, and several other items. You pay a premium for Part B coverage. For most Medicare-eligible individuals, the monthly premium in 2020 is $144.60, which is the lowest standard monthly premium Part B premium amount. Some members will pay more, depending upon their income. This premium is usually deducted from one's Social Security check. Otherwise, they're billed quarterly, meaning they'll bill you for 3 months' worth. The way they determine what your premium is going to be is they look at your income 2 years back. So, for example, in 2020, they would look at your 2018 reporting to the IRS. They would see your income and then apply that to their sliding scale to determine your Part B premium. To know if a test, item, or service is covered, you may go on to www.medicare.gov and look under what Medicare covers, and you will be able to enter and search for other items as well. Enrolling in Medicare Parts A and B. If one is already getting benefits from Social Security, except if you are working or you have end-stage renal disease, you'll be automatically enrolled and receive your Medicare card in the mail. You can apply online at Social Security. You may call Social Security at 1-800-772-1213. You can visit your local Social Security office, although I would recommend you contact them to make an appointment first. That would help eliminate the long wait. Fill out an application for enrollment in Medicare Part B. Submit it in person to any Social Security office or mail it to your nearest Social Security office. Note, completing the application form and submitting it does not automatically enroll you in Medicare Part B. Social Security must first determine if you are eligible to enroll. Enrolling in Medicare Part B at the right time is critical. Here's that 7-month window period I spoke of earlier. 3 months before your 65th birthday, effective the first day of your birthday month. Birthday month, effective the first day of the month following your birthday. 2 to 3 months after 65th birthday, effective the first day of the 3rd month after enrollment. Although if you look back at the example I gave you about the 17-year member, where enrolling in Medicare and the Senior Advantage reduced his costs to $0 a month, why wait past your possible effective date and still pay the additional $350 so? You want to try to apply as soon as you can so that you can start the savings. Social Security's enrollment period, if you missed the initial period, can change. January through March each year, coverage becomes effective July 1st of that year, which means you would have to wait several months until July 1st to be able to get into the Medicare plan, saving you some money. Lifetime 10% penalty for each 12-month period one did not enroll in Part B. Exception: working age may delay enrollment in Part B until retirement. In other words, you're still working, yet you're on an employer group plan. Then you can waive your enrollment into Part B so that you don't have to pay that premium for the Part B until you stop working and come off of your employer's plan. As you know you're going to come off the employer's plan, or you're going to go ahead and actually retire, you want to reach out to Social Security and say, hey, I'm going to stop working. I'm going to lose my employer's plan. Now I'm going to need my Medicare Part B and A. That way they can go ahead and begin the process to enroll you without charging you a penalty. Part B, important to avoid the penalties. If you delay enrollment in Part B and are not covered by an employer plan, you will have a penalty. Late enrollment penalties, 10% for each 12-month period you was not enrolled. And that's a permanent penalty. Enrollment can only enroll January 1st through March 31st each year. Coverage will not begin until July 1st. Also, to purchase a Medigap or Medicare Advantage plan, you must have Medicare Part B. Employer plans. Actively working. Your options. Again, delay Part B enrollment. Use only your employer plan. Enroll in Parts A and B and have both Medicare and your employer plan. Although it's not likely that you're going to get any additional benefit from that, because Medicare will look at your employer's plan as primary and push any bills or for services to them. So basically you'd be paying your premiums to Medicare and they're not going to cover anything because they're going to say your employer's plan is primary. Reject the employer plan, enroll in Medicare, and then supplement in other ways. That's not an option I would look for. Medicare Part B monthly premium for 2020. Here's what I spoke of earlier. If your yearly income in 2018 for what you pay in 2020 was, and as you can see the chart, filing an individual tax return, $87,000 or less, your 2020 premium would be $144.60. If your income was $109,000 to $136,000, then your Part B premium will be $289.20, and so on. So you can see how it increases as you reach a different tax bracket. Acera, our Medicare Part B reimbursement plan. This is a great plan. Medicare Part B is a reimbursement plan adopted by the Board of Retirement annually, and they authorize us to reimburse of the Part B premium that you're paying. Now, currently, The monthly reimbursement for 2020 is $144.60. That's the base amount. There are some members based on their income who pay higher than that. However, we will reimburse into their retirement check the amount of $144.60. That still just leaves a difference if they have a higher premium of what they're paying. This non-vested benefit is not available for dependents, nor will it be reimbursed dependent costs. This non-vested benefit is not available for dependents, nor will it reimburse dependent costs. To qualify for MBRP, a retiree must have at least 10 years of service credit or a service-connected disability, provide proof of enrollment in Medicare Part B, and remain enrolled. Enroll in the MBRP commencement begins when we receive your form and proof of your Medicare Part B enrollment, basically your copy of your Medicare card. This is not a retroactive benefit. Enrollment is not automatic. If eligible, you must complete the Medicare Part B reimbursement plan application form to receive your reimbursement and provide proof of your Part B enrollment, such as a copy of your Medicare card that shows you have B. Enrollment in an Acera medical plan is not required. So you're not required to be enrolled in one of Acera's plans. You may be enrolled elsewhere through another employer, through your dependents, or just elsewhere, period. It's a years of service benefit. It's not tied to you being enrolled in one of Acera's medical plans. Medicare Part D. The standard Medicare Part D drug benefit contains what was considered a donut hole, a gap in where beneficiaries pay for the full amount of what the premiums costs are for the medications. There is a point where the medical plan that you have for your prescriptions, you no longer pay the copay. At a certain point, you pay what the cost is for that medication until you reach another threshold in which the costs then drop down tremendously. However, in 2020, Medicare pays 75% of the price of a generic RX, and you pay 25% of the drug's price. An example, in 2020, Mrs. Anderson reaches the coverage gap in her Medicare drug plan. She goes to a pharmacy to fill a prescription for a covered generic drug. The price of this drug is $20. There's a $2 dispensing fee that gets added to the cost. Mrs. Anderson pays 25% of the plan's cost for the drug and dispensing fee. $22 times 25 cents equals $5.50. In 2020, although, you'll pay no more than 25% of the price for the brand name drug. 95% of the price. What you pay plus the 70% manufacturer discount payment will count as out-of-pocket costs, which will help you get through the coverage gap. For example, in 2020, Ms. Anderson reaches the coverage gap in her Medicare drug plan. She goes to her pharmacy to fill a prescription for a covered brand name drug. The price of the drug is $60, and there's a $2 dispensing fee that gets added to the cost. Mrs. Anderson pays 25% of the plan's cost for the drug and dispensing fee. $62 times the 0.25 equals $15.50. The amount Mrs. Anderson pays, the $15.50, plus the manufacturer discount payment, $60 times 0.70 equals $42. Count as out-of-pocket spending. So $57.50, $42 plus the $15.50 counts as an out-of-pocket spending and helps Mrs. Anderson get out of that coverage gap. The remaining $450, which is 5% of the drug cost and 75% of the dispensing fee paid by the drug plan, doesn't count towards Mrs. Anderson's out-of-pocket spending. Part D premiums by income. Similar to Part B, for the Part D, they also do a 2-year look back. Looking at the chart, you'll see we're using 2020. The chart reflects the 2018s. So someone who has a reported income of $87,000, you're just paying for your plan premium. You do not have a penalty in regards to the Part D. Anyone above 87,000 up to 109,000, then you'll see a monthly reported adjustment of $1,220 plus your plan premium. Okay, that would be your out-of-pocket costs of what you're paying for your Part D. It's called the income-related monthly adjustment, and that comes to you as a bill that you would pay directly to Medicare. If you fail to pay that or refuse to pay that, Medicare will disenroll you from Medicare, which will cause a disruption to your insurance coverage. Types of Medicare plans. You have Medicare Advantage plans, and you have Medigap supplemental plans. The Medicare Advantage plans are plans where you have a primary physician, and that's the physician you go to see. You would have to go see that physician to get a referral to go see a specialist. You also have copays, and those copays may vary. You also must reside within the plan's service area. For Medigap plans, supplemental plans, those you do not have a primary physician. You can see any physician that accepts Medicare, which is why those plans are nationwide. You may be residing here in California, and yet the doctor you want to see may be a specialist over in New York or Florida. You can contact that doctor's office. If they accept Medicare, then you would be able to fly all the way out there or drive, or however you want to get there, and be able to be seen by that specialist or doctor because of the Medicare. Again, you're not assigned to a primary doctor. Your Medicare remains primary. So you can go see any doctor and go to any facility that accepts Medicare. Okay, you do not need a referral to go see a specialist. As long as the specialist takes Medicare, you're able to go. These are medical only. It does not have a prescription drug component. You will need to enroll into a prescription Part D plan. Copays and deductibles may vary depending upon the plan structure you select. Also, the United States is the service area throughout the United States. Acera-sponsored medical plans, non-vested benefits, non-Medicare eligible. For those members who are under age 65, the Acera group plans that we offer are Kaiser Permanente HMO, United Healthcare Signature Value HMO, and then the United Healthcare Signature Value Advantage. For those who become Medicare eligible, and it's usually those who are age 65 or older, we have Kaiser Senior Advantage. If you do not wish to enroll in Kaiser Senior Advantage, then you would want to contact Via Benefits, and they can assist you to enroll in a Medicare plan of your choosing. Kaiser Permanente Senior Advantage. The eligibility to enroll in this plan is to have your Medicare. Okay, once you have your Medicare, you're allowed to enroll in Senior Advantage, and thus you'll be saving money on the premiums. As you can see, our Kaiser Senior Advantage is only for California residents only. Yes, Kaiser is in other states, but our contract is with Kaiser Senior Advantage here in California. The 2020 monthly premiums for yourself, self only, is $411.54. Self plus one, if both of you and your dependent both have Medicare, it's $411.54 each. So it'd be $823.08. Benefits on this plan, your copay is reduced down to $10 for office visits, and you also have $10 prescriptions. For Via Benefits Medicare plans, plans through the Medicare Exchange are not Acera group plans. They are individual plans and will not appear on your monthly retirement statement from Acera. Members and dependents are solely responsible to pay any premiums to those carriers to maintain the insurance coverage. Members who are eligible for Acera's monthly medical allowance will be granted a health reimbursement account for their medical out-of-pocket expenses up to the qualified amount. Only the retiree members are eligible to submit claims through the HRA for their out-of-pocket expenses and not dependents. Dependents will not be reimbursed. Via benefits enrollment. Enrollment is done via a phone interview. Carriers require both Medicare Parts A and B. Most Medicare Advantage plans have Part D built into it. That is the prescription portion. Medigap supplemental plans are medical. You'll need to enroll in a Part D prescription plan for prescription coverage. And Via Benefits agent will assist you to do that. A licensed benefits advisor will go over plans available in your area and provide you with several options. Plans are nationwide. Reimbursement available for retirees' out-of-pocket medical expenses, medical and prescription drug premiums, prescription copays and deductibles, and medical necessary costs. You can set up auto pay and direct deposit through Via Benefits. Reimbursements for the current plan year must be claimed by March 31st of the following year. For example, we're in 2020. So if a retiree member had an out-of-pocket cost and they had not submitted to get reimbursed, they still have until March 31st of this year, 2020, to submit that claim so that they can be reimbursed out of their 2019 funds that were available. Online health reimbursement account tracking and status updates. When you enroll through Via Benefits, you can set up an online account login. This will allow you to access your health reimbursement account, view your balance, see any pending items that's being approved, and the status of items. Via Benefits, prescription profiler. Very good item, very good benefit. For Medicare Part D, the prescription pharmaceutical companies, they are adding many prescriptions yearly. And also the prescriptions you currently have often change tiers, which means so does their costs. So to know if you're still getting the best bang for your buck on the prescription drug plan that you're enrolled in, we recommend that at least every October during open enrollment, you contact Via Benefits to inquire about your Medicare drug plan. Okay, they'll be able to enter your prescriptions into the prescription profiler, and it will provide a listing of how your drug plan compares to others. You may find that you may save money and your prescription costs may be lower if you switch to a different plan. So it's always good to check in to see whether or not you're getting the best prescription coverage you can. Also, by going to a prescription profiler, it'll allow you to break down the costs of all your medications. This allows you to see if there are other plans with lower costs for your prescriptions other than your current plan. Not that you have to make a change, but it's good to know whether or not you're saving what you can save. Open enrollment. Your annual opportunity to assess your benefit needs and make changes if needed. You can change medical, dental, and vision plans, add, remove dependents, or cancel medical, dental, vision coverage. Retirees with 10 or more years of service must remain enrolled in the dental and vision plans as covered by Acera. We subsidize those for them. Acera open enrollment occurs every November. Elections made during Acera's open enrollment becomes effective February 1st of the following year. Via Benefits open enrollment occurs from October 15th through December 7th, with elections becoming effective January 1st of the following year. 1 month's retirement allowance must be sufficient to cover the cost of the elected health plan coverages. Monthly medical allowance, MMA, that Acera pays. All right, let's have a look at this. For someone who has 20 years or more, in 2020, we've subsidized up to $578.65. Someone 15 to 19 years of service, we do $433.99. 10 to 15 is $289. Anyone with less than 10 years, there is no subsidy available. For Medicare exchange, once you go to via benefits, someone with 20 or more years of service, in 2020, we're subsidizing $443.28 is what we're putting into the health reimbursement account every month. For someone from 15 to 19, we're placing $332.46. And someone 10 to 14 years of service, $221.64. This is the amount that we place into the health reimbursement account every month for the person's reimbursement of their out-of-pocket items. Now you may say, well, why are these amounts so much lower than the chart on the above? The costs of the plans through the exchange for Medicare are extremely lower in premium, and thus a vast majority of our members never use up all the funds that are placed into their health reimbursement account. All their out-of-pocket items are taken care of. Qualifying events. A loss of coverage, relocating out of the service area, annual open enrollment, becoming Medicare eligible, retiring after age 65, and marriage. These are all qualifying events which allows you to add a dependent or change plans. Special note, premiums for your medical, dental, and vision coverage are based on the plan and coverage levels you select. Your monthly retirement allowance must be sufficient to cover the selected plan premium. You cannot select a plan that is higher than what you're being paid. Moving out of the service area. This happens quite a bit. Members relocate and forget to contact Acera. Don't forget to look into available health plans prior to moving. When relocating, it is critical that you look into the coverage area of your current plan. You may reach out to Acera for assistance in this matter. You must complete an Acera address change form to update your address. Only a signed change form will be accepted. No phone calls and no emails. This is for your safety as well. We wouldn't want someone pretending to be you changing your information. Retirees who reside outside of California may not be required to pay California state taxes. So you may want to submit a tax form for state telling us not to retake any state taxes. Remember to send Acera a completed address change form. You can download this form from our website, www.acera.org/forms. We're here to help. You can always reach out to us for forms, one-on-one consultation and assistance, extra forms if needed, answer personal retirement questions, complete your seminar evaluations. Simply contact Acera at www.acera.org/contact-us. You can submit any questions you may have to that web address right there, to contact us, and we'll respond to you accordingly. Thank you and have a great day.